Dr. Anant Mohan, Professor in HOD, Department of Pulmonary Medicine and Sleep Disorders, AIMS, joins us on the broadcast here. Very warm welcome to you, Dr. Mohan. Doctor, first and foremost, the survey tells us that at least 81% of people, families in the Delhi National Capital Region, have a member with pollution-related illnesses. Are you witnessing the same trend in terms of patients in the Delhi-NCR area?
Good morning. Yes, we are. Yes, we are. You have already highlighted some important statistics and figures related to the air pollution related illnesses. And most of them are actually the case, they are true. And we are witnessing a rapid, sudden surge in respiratory related illnesses in our OPDs. And I'm sure others must be doing the same. People who were previously controlled, doing okay with whatever medicine they had, suddenly are coming with increased symptoms, markedly increased symptoms, sometimes even landing up in emergencies and having to be given almost like critical emergency type care. The use of inhalers has to be increased, the dose has to be increased. So definitely we are witnessing a huge surge of respiratory related problems, not just in those who are already having respiratory illness, but even in those who are otherwise healthy.
You see, at the same point in time, experts, are contradicting with the kind of suggestions that they're giving out. People are saying, let your windows shut. At the same time, those who don't have the privilege of using an air purifier at home, they're suggesting maintain good ventilation. How does that happen, doctor? I mean, you're asking somebody to shut their windows, but at the same time, maintain the right kind of ventilation.
Yeah, so actually, yeah, it's not easy. I mean, obviously, we need some fresh air, obviously, but the fresh air is not clean. So what to do? But yes, one does need some fresh air, and that is meaning, especially for the people who are having diseased people at home. For them, probably it would be better to be staying indoors rather than outdoors. Air purifiers, although not conclusively proven to help, have now been proven to help in some situations, especially with chronic respiratory disease. Those people who are at home and they use it, it might help to some extent. A couple of other things I think would be to use masks. I think they have to, when and especially when they go outside and outdoor, they have to use the mask is very important. So it is fine balance between how much you open yourself to the atmosphere and how much you have to shut out. A little bit of balance, of course, you need some air inside.
No, you're absolutely right, doctor. Are there particular groups like the children, the elderly, pregnant women who are, let's say, more susceptible to the air pollution situation, the air crisis that we're seeing in Delhi NCR?
Yes, absolutely they are. And they obviously, the young children, their lungs are at the developing stage. Also, they have a tendency to play, and they consume oxygen at a much faster rate and greater quantities as an adult. So just see if they go outside and they breathe fast. So the amount of air they take in would be several times higher as compared to an adult, and that would be all toxic contaminated air. Naturally, they are going to get sick faster, and that is true. They get sick faster. Similarly, elderly people, they are immunocompromised. Their lungs obviously would not be working at the same level as for a healthy adult. So they are also compromised. So both the extreme of ages are at higher risk for respiratory related complications and even other disease complications for that matter related to a poor air quality.
You know what, doctor? We're flashing some of those precautions that have been put out by various health experts. Would you like to divulge some, special anecdotal, tip or technique that you yourself use in this current situation? And also, like dietary choices like antioxidants, vitamin C, do they really help?
See, regarding these dietary changes, they may help, but again, they are not short term. They are not short term solutions. Not just by popping a couple of pills during the couple of weeks at this time is going to make much of a difference. It is your overall body system how it helps you to battle against these and other illnesses. So it is a holistic nutrition and good diet as a whole, and not probably just a short term taking of some vitamins or antioxidants. That is, to my mind, the thing. As far as other things are concerned at an individual level, a couple of tips is that instead of now all the people, hundreds, thousands of people, instead of taking the morning walks, it is better that they defer their morning walks for a couple of hours and go more in the midday, if possible, in the noon time when the bit of sun is out. In the morning, today, you know very well, even I was out of the house at 7:30 in the morning. The AQI was around 600, 600 plus. So there is just no point in going out taking brisk morning walks at this point of time. And again, it is mostly the elderly people who do that. They are going to be much more at risk. So that is one thing that we need to change probably during this time period. Wear a mask whenever you go out. I think that's the best we can do. But I must say that this is an absolute emergency situation.